Thank you, Mr. Speaker. Any and all individuals in Alberta should have access to highest level of publicly funded medical care. You would think that anyone born in Alberta would automatically receive this option. However, if a child is born in Alberta to parents who do not have resident status and are awaiting paperwork, that child is not entitled to Alberta health care. To the Minister of Health, this issue was raised within my constituency, and I'm wondering what can we do to fix this unfortunate and unfair loophole?
Minister of Health.
Thank you very much, Mr. Speaker, for the question. Certainly, according to our governing bodies, including the legislation that we pass here in the House, all Canadians have access to Canadian health care. So if there's a specific instance that the member would like to follow up with my office, if the child's a Canadian, certainly we'd be happy to follow up on that and make sure they get the right health care services that they need. Thank you.
First supplemental.
Thank you, Mr. Speaker. Given that individuals immigrate to Alberta from all over the world, and given that when they do so, they often bring with them the cultural differences and language concerns, and given that in healthcare, the relationship and understanding between a doctor and their patient is paramount to successful diagnosis and treatment, again to the Minister, can you please outline for the House steps that are being taken to improve cultural understanding and the competencies within our Alberta healthcare?
Minister of Health.
Thank you very much for the question. We'd be happy to arrange some follow-up opportunities to do some work if individuals in your office who are supporting your constituents on casework would like more information. But certainly we have a translational phone line. We have work that's happening in Alberta Health Services, both around newcomers as well as Indigenous Albertans, and there is much more work that needs to be done. But certainly being able to communicate in your first language and making sure that you're able to articulate what you're experiencing is number one, and offering respect to anyone who walks through those doors. So thank you for the question.
Second supplemental.
Thank you, Mr. Speaker. Given mental health issues are serious concerns for all Albertans, and given that some immigrants who arrive in Alberta bring with them mental health concerns for various reasons from their home countries, and given that stigmas still exist about mental health awareness in some cultures and countries, again to the Minister, can you outline for the House specific programs in place which seek to increase the uptake of recent immigrant exploring and utilizing all mental health supports available to them?
Good question. Minister of Health.
Thank you very much for the question, Mr. Speaker, and to the member for asking it. Certainly this is an area of priority for our government and something that we're very proud to be moving forward on. In terms of specific pieces, I'd be happy to table something in the House that gets to the level of detail that I think the member is asking for, so that all members might be able to have access to some outlines and be able to share it with their constituents.